gender-based violence, and COVID-19. Lockdown and GBV. The WHO states that 1 in 3 women will experience GBV in their lifetime. GBV is rooted in power and control, and the lockdown has taken away all our power and control. The abuser will do anything to gain control over the family. Lockdown makes this very easy for the abuser. Currently, victims of GBV find themselves trapped in their homes with their abusers, and they are more isolated than usual. The abuser will be more controlling than usual to regain power and control that is lost due to the national lockdown. Stress, isolation, restricted movement are all exacerbated risk of GBV in the home. During lockdown, families are forced to spend more time in close proximity with each other. Things like lack of cigarettes or alcohol may all be triggers for the abuser to act out quicker and faster. Stress due to potential loss of jobs and income will also increase the risk of violent outbursts. Access to shelters or any place of safety are very limited during lockdown, as victims cannot easily leave their homes. Abusers may use the lockdown restrictions as a way of getting power over the household, withholding basic items, soap, food, and even information in this time is all a way for the abuser to gain control. What can we learn from previous outbreaks? During the Ebola outbreak, countries around Africa saw huge increases in teenage pregnancies that are directly linked to them being raped during the epidemic. In Sierra Leone, teenage pregnancy rates increased by 65% during this time. There's also evidence that hunger in this time leads to a food for sex trade system. During times of pandemics, law enforcement agencies are overwhelmed and not able to always deal with GBV. Reporting of GBV during this time might also not be as effective. Many countries do not have a response to GBV in their national disaster plans. This leads to healthcare workers being pulled to the front line of the pandemic, which creates a lack of services for victims. GBV, COVID-19 lockdown and the health sector response. Healthcare workers must assume that GBV is still taking place and be always aware of signs when dealing with COVID-19 patients. Healthcare workers is the first point of contact in this time, and they should know how to identify victims of GBV. As healthcare focuses on COVID-19, sexual and reproductive health care may be overlooked. Isolation creates an opportunity for the healthcare worker to help a victim of violence, to educate them and also assist them during the time that they are away from the abuser. Children might lose their parents to the disease, which will leave them vulnerable for any predator. The more cases of COVID-19, the more the health sector will have to stretch their services. What do we already know about GBV and COVID-19? We know that the abuser will use the lockdown period to isolate the family even further, to withhold information, and use scare tactics to keep them in the home. Stats from China shows that GBV has increased during lockdown, and in South Africa, initial data shows the same progressive increase during lockdown. Actions that should be taken. Joint action is needed between the police, military and healthcare services. It is also important that these groups are trained in GBV in order to identify any victims of violence. GBV centers should be staffed and staff should be trained on COVID-19. Emergency contact numbers must be made available for victims, and EMS staff must be trained on identifying GBV signs in all families. There are many organizations out there that can help victims of gender-based violence. Don't turn a blind eye. Help someone today.